I feel like the story is just getting started. This is after the death of the CEO of United Healthcare, an insurance health company in the United States. Now, people are getting out to say the truth, and especially people who worked in these health facility. I want you to watch this video. I'll be back and we'll talk about it because shit's just getting weird. Let's dive right into it.
I'm going to tell you a little story. This was a long time ago. Sex change operations were new and they were an exclusion across the board on all policies. Okay. I don't know if that's the same now or not. I don't know. And it doesn't really matter what my feelings are on that specific issue because this is not that specific issue. As I had been working for United Healthcare, I became a customer advocate, and I had gotten a call one day. So I was focused on the problems now. These were big problems. I wasn't just verifying benefits and sending out cards and reprocessing claims and things like that. This was people who had issues, okay? And I got a call from a doctor's office. It was a 14-year-old girl. She was in our system as female, who we had paid to have her testicles removed, but we wouldn't pay for the reconstruction of a vagina. This was not somebody looking for a sex change, which was how they this is how they denied it, was a sex change. This was a child who was a genuine hermaphrodite, okay, born with multiple sex parts, okay, a true medical condition. I don't know the outcome on that. I was first talking to the doctors and I talked to the nurse. I didn't talk to the parents because there was a language barrier. That was in, all I could do was advise the people that I was talking to who were professionals on what they had to do on the appeal process. And of course, they're trying to get this done, right? So eventually I talked to the doctor. That's how I know details on this particular case. And doctor ended up saying that he was going to go ahead and do it anyway. I don't know who paid for it. He probably ate the cost. But this one always stuck with me because I'm thinking, when you're 14 years old, being 14 sucks, okay? It does. It's a horrible time in your life, and people go through puberty at a different time. But everything I thought about was, what was it like for this kid to go through puberty and have gym and be in a locker room and have this problem with their body? And I just don't know. Anyway, that was one of the cases. And I know that that's a really hot topic right now. I don't put this under that umbrella with the LGBTQ community. This was something that was actual birth defect that they were pushing back on. Okay. Lord have mercy. But it wasn't just that. It was things like, on a more day-to-day basis, dealing with claims that were denied because somebody went to the emergency room for a sprain. Now, see, here's where the kicker is, and where the delay and the deny comes in, that shooter put on the bullets. See, they can delay a claim because the provider is required to put the diagnosis on. So I sprained my ankle, right? I went to the emergency room. It wasn't a true emergency because it was a sprain. I need to put ice on it and elevate it and, just maybe wrap it. It's not an emergency. But I don't know that. I'm out walking in my yard and I fall and I twist my ankle and it hurts like hell and I can't walk on it. How am I supposed to know? So I go to the emergency room. They do an x-ray. It's not broken. It's just sprained. But they've denied it. Okay, so now we have to appeal it. The thing of it is, and this is what they don't tell people. And so I'm telling you right now, if you have what you think is an emergency, a true emergency, okay? Because you don't know. The definition of an emergency in layman's terms, write this down if you can't remember it, is a fear of loss of life or limb. Okay? And it would happen a lot of times with migraines. People would have a migraine, and it would be one of those migraines that came on real sudden, and like, your eyes don't work right anymore. Not a migraine that builds up, but a sudden migraine that you don't normally have, right? And they don't know if they're having a stroke. So they go to the hospital. Turns out it's a migraine. It's declined. It's denied. Because it's not an emergency. A migraine's not an emergency. We know that. But here you are, you're sitting at your kitchen table drinking your coffee, and all of a sudden you feel like you got shot in the head. You don't know if you're having a stroke or an aneurysm or what. So the logical thing to do as a person who does not have a bunch of medical equipment and personnel following you around, checking your every, stat of the day, you go to the emergency room, right? Thank God it's not a stroke or an aneurysm, but they deny the claim. Yeah, so that's a tip right there, okay? If you're a regular person walking down the road and you think something happened that's an emergency, you don't know, go to the hospital. And then call your insurance company if it turns out that you're okay. Thank God, right? I had a whole lot of thank God this year. So they don't care about the providers because they don't have to pay them, or they don't want to pay them. They don't care about the members. That's what they called them, customers. As long as they're paying their premiums. They really don't care. And they don't care about the employees either, let me tell you. They don't care. It's all about bottom line. So here's my personal experience, okay? After United Healthcare acquired MAMZ, of course, they started to phase that out. And then that insurance doesn't even exist anymore, I don't believe. And so as the MAMZ product was being phased out, they had employees that they, quote, didn't need anymore. And they did a mass layoff. And because they did this mass layoff, they also had people quitting. And the CEO at the time realized that that was a huge mistake, because people were now feeling like their job was in jeopardy. Maybe they should just start looking. And so they did. And he said that it was a mistake, and that from now on they wouldn't just do these surprise layoffs, okay? That they would give people a chance. They'd let them know that we're closing your department in such and such amount of time, and you have a chance to either reapply through the company for another position or look for another job, okay? And that seems reasonable to me. It's not a law, but it's a reasonable way to, first of all, keep morale up, right? Yeah, that didn't come out. That didn't hold water or whatever, because that's not what happened to me. Okay, I'm going to tell you that right now. And let me tell you something. They know for a long time before they're going to lay off. They know. This is planned. There's all kinds of things put in place before they do the actual layoff. Okay? It's very organized. It's not just, oh, next week we're going to lay off these people. It's not. And I tell you that, and I can tell you why. They knew a year before they laid off my team. They knew a year before. And the signs were there. I actually, hindsight's always 20/20. So my team, we were the evening, weekend, and holiday team. So we worked at night when the rest of my department was closed. We worked on the weekends when the rest of my department was closed, and we worked the holidays when the rest of my department was closed. Okay, so we worked the crap hours. And yes, the calls were less during that time period, but there were certain things that you had to keep in mind. So, I was at the point, I kept asking for a requisition to hire more people. I was down to 5 people. At peak season, I had 50, but at this point, it was like summertime, and I was down to like 5 people. My team originally was 10, okay? But See, they go by numbers. They don't go by the people. They don't use common sense when it comes to running a business. All they looked at was the numbers. And our workforce team decided that 5 people was enough for the coverage based on the number of calls that came in after hours and on holidays and on weekends. And so I wasn't even working this day. And I had one girl working. It was a Saturday or a Sunday, and the calls were getting backed up because there was only one person working. So people were in the queue for a very long period of time. And I'm talking like 20, 30 minutes. And then she had to take her lunch break, which she's required to take. So she's off the phone for 30 minutes. That means there's nobody to take a call during her lunch break or her breaks. She's entitled to 15-minute breaks on an 8-hour shift, right? She gets 2 15-minute breaks and a 30-minute lunch. And so now she's got people who have been on hold for a long period of time, and they're pissed. They're mad, first of all, that whatever's going wrong. And then second of all, they're mad because they had to wait so long. So all this time that they're waiting for her to take the next call, they're infuriated, right? And they're screaming and yelling at her. Please be nice to your customer service representative when you call. It's not their fault, okay? They're trying to help you. Anyway, she was ready to walk off, and I begged her not to, and I'm calling my boss on her day off. Okay, she called me on my day off, and I called my boss on her day off, who was in Duluth, and I explained it to her, and now this had been going on for months, okay? This had been going on for months, and finally I told her, I said, there's more to it than just the numbers, okay? There's more to it than just the numbers. Like, she's trying to explain to me that cost-wise, it doesn't make sense to have more people because the numbers don't support it. Well, that's true, okay? If you're only looking at the numbers, but you're not thinking about the employees who have to deal with this, and you're not thinking about the customers. In this case, it had to do with the FSA cards and the HSA cards, so their MasterCards. So these people are standing in Walmart trying to get their prescription, and it's being denied for some reason, which is embarrassing, okay? Because the person behind you doesn't know that this is linked to your insurance. It just looks like you didn't pay your bill, okay? And you people above me have college educations. Do you not know? Can you not relate to what's going on out there on the street and on your first line people who represent your company? Do you not know? Do you not know? Can you not put yourself in those shoes and imagine how embarrassing it would be when you're trying to get an antibiotic because your kid is at home sick and can't breathe, and your insurance is, your card that you're supposed to pay this with isn't working right? Of course you're upset, right? And so you're calling this girl who's sitting in an office all by herself, and I'm talking like she's the only person in the building except for the security. And there's nobody there to help her. Excuse me. And so, yeah, they don't care. They don't care. Well, when I used that kind of logic, I did get a requisition, and I got more people to come in and work for me. Because you can't argue with common sense, right? Well, you can, but it just didn't make any sense. Anyway, so there was that. I also had, not this particular manager who got me the requisition, but the one before her. Oh my God. So they had this thing that they send out every year. They called it Vital Signs. It was a questionnaire to find out about employee engagement. And every employee in the company filled it out. And one of the things that was on it, and it had to do with people in leadership. So me, and everybody above me that I reported to, had to do with their performance based on the culture that was in the company. Okay, so if you scored high, you know, your employees trusted you and they respected you and they really wanted to work for you. Okay, but if you scored low, there might have been a problem with your management skills. Okay, and my boss really didn't score that high. And the reason why is because she was abusive. Okay, that is the word, abusive. That is the word I'm using. She was an abusive person. She would talk nasty to people. She would harp on something. If she corrected something, she would bring it up later. Like, okay, we're all learning. I don't have a problem with my manager or supervisor coming to me and saying, look, I need you to work on this. This is an area where you need to improve. Okay, that's fine. That's part of the job of management, right? Is to try to make their employees better. That's fine. But when that problem's been addressed and corrected, and you come back 6 months later and bring it up just because you feel like picking at somebody, I got a problem with that. And it wasn't even done nicely or professionally. It was done nasty. So we're having this meeting with all of my peers, and her boss called it passionate. It wasn't passionate. It was abusive. And this woman really needed to have that addressed because she was not going along with what the culture was that we were supposed to be conveying to our employees. So she would say, basically, I want you to treat your employees this way, but I'm going to treat you that way. Anyway, I don't know if she's still with the company. I really don't care. She pops up on my Facebook as somebody I might know. Still, after all these years, I should just block her. Anyway, I went to work they changed some things corporately, and I ended up working with another person, the person that got me the requisite so that I could hire. And I was always asking for other things to do for me and my team, okay? Because there was downtime. They could have used us to do other things after hours that the daytime team maybe didn't have time for, but they never gave that to us. Oh, I want to go back to this vital signs thing. So, going back, there was the engagement score, but there was also a manager effectiveness score, which, it was there, but nobody ever used that. They used the employee engagement score. And finally, after a couple years of this, I thought, why aren't they using that manager effectiveness? That relates more directly to me than the overall feeling of the employees towards the company. And so I wrote up this proposal, and one of the things I used to support my suggestion was back in 2008. The economy was really, really bad, and that year they had to, what they decided to do was not give any raises that year. Nobody got a raise, supposedly, although I believe there were some people who got bonuses. Anyway, I'm not even going to go there. So they didn't give out raises, and the rationale was they didn't want to lay people off because, it didn't work out so good. But anyway, they were trying to be nice about not laying people off during a really bad economic time. And the engagement wasn't so great that year. And so what I proposed, and they were always saying it's the manager's responsibility to make sure that the employees were engaged. It's our responsibility. Well, I can't get in somebody's brain. I mean, I can present an idea, I can explain the rationale for something, but I can't control somebody's thoughts. And that was the example that I used, that I can explain this rationale why they didn't give raises was just so that nobody lost their job. But I can't keep somebody from thinking, well, screw them. I don't care if somebody gets laid off. I want my raise. That's common sense. I don't have control over that. And so I, excuse me, I sent this to them, and it just kind of was, oh, this is great. And that was the end of that. I never heard anything else about it. So almost a year later, a little bit time before review time, can you resend that to me? I don't know where I put it. Of course I can, because I saved it. Okay? So I sent it to them. I don't know if they ever implemented my idea or not. That makes a hell of a lot more sense than what they were doing at the time. I don't know. But anyway, I sent it to them. And don't you know, within a very short period of time, it was, I think, August or September, before open enrollment, before they got really busy, they called me one day and they said, we're coming in tomorrow, my boss's boss, and your team is going to be laid off. We want you to come tomorrow and help us. Okay. Sure, I'll do that. Because you gave us enough time to find a job. You gave us warning like you said you would way back. So I left, and oh, by the way, I had people working on my team that had been with the company longer than I had. Okay, so what that says is that, that's what I was told by my leadership, I'm really good at retaining employees. My team was very engaged, and it was. My engagement scores on my team were very high, well outside the expectation. Okay, and yeah, can you believe it? Cleaning lady can have good, good leadership skills, whatever. So, yep, they told. I said I'm leaving. When my team came into work that night, I wasn't there. I left. I said I'm not staying. Because there's no way I could have stayed there with my team that night and not told them what was happening. There's no way. No way. And he was going to come in because it was nighttime. He would be there probably around 4 o'clock. I would have to find a place for him to meet with people. And my team comes in at 5, and I told him not to get on the phones. I told him what was happening. Just stay. You need to stay. And they're going to tell you what your severance package is and so on and so forth. And when everybody was laid off, I left. And I'm driving home. It's dark. And don't you know, my supervisor calls me, bawling her eyes out. I don't feel sorry for you. You knew this was coming. Why are you crying to me? You still got a job. And it could have been handled a lot differently. And here I am on the highway in the dark at night, and you want to sob to me when I'm the one that lost my job? Whatever, shut up. Anyway, we shouldn't go around shooting people, okay? That's not cool. That is not cool. But, and I'm pretty sure United Healthcare is not the only one that has these problems and does these things. I know they're not, okay? I think the insurance companies need to take a good hard look at what they're doing to people across the board. And meanwhile, I'm going to go clean somebody's toilet today, and I'm going to be happy about it.
Wow, that was so devastating at the same time. But again, it's important that she came out clean to share her experiences. That I believe it's important that she talks about it now. The name of this lady who shared the story, she's called I'm the Boss of Me 63. You might want to go check her out, go check her channel out because it's important. The courtesy of this video is from his channel, and I want us to get to see what really people said, because a lot can really happen in a short span of time, because this is just 1 week, and you could hear stories which are coming out, and I'm glad that people are getting to talk about this. Now, back to the main theme of corporate greed and the hands of US government in always making its citizens poor. The United States hates its citizen. The US government hates its citizen. In as much as its citizens love him, but he hates his people. Because you could hear from the stories that people are giving, this is just an health insurance company that is doing to people this. Now, I want us to hear the opinion, what people really said about this. Now listen. And this is why you get to know the truth from the comment section, where people open up and talk about some things that you might or you didn't expect them to talk about. Somebody said that no one blames healthcare providers. Of course, they're being employed to work there. Working citizens are not the problem. The problem is the corporate greed. The rich keep getting richer at the expense of the American citizen. And I told you that the United States hate to see its citizens grow. You could see how people are treated just from the story of this woman. This really tells you a lot of things. Somebody said that I worked as a nurse in an insurance company. Everything this woman YouTuber says is true. This YouTuber actually held back and was not critical of insurance companies, as insurance companies deserve. Personally, I worked hard to be patient, advocate, and help every person that God sent my way. You have to know the system in order to help the patient. There were so many employees so burnt out that they didn't care and wouldn't help. So it's true. P.S. Cleaning homes and toilets for living is honorable, honest work that benefits others. Don't ever belittle that employment category. Yeah, that's one of the most important things. Imagine if we didn't have people that do that in the facilities that people are. You can imagine how life would be. Life couldn't be the same for people, right? Now, somebody is saying that as a healthcare worker, I approve this message. It's really important because people need to know the truth. The truth is being shared with everyone out there. Somebody said that corporate greed and their over-exaggerated sense of self-importance is the problem in America's healthcare system. That is true. That's really, really true. Somebody said that back in 1989, we had our first son. He was born C-section because of his viability. He had surgery, then died after day 11. Our insurance company denied our claim for him. My wife called, asked for denial reasons. The CS agent said he stayed in the hospital too many days. My wife said he died in the hospital. The agent said, please hold. A superior came on the phone, apologized, and said everything will be covered. We should have never gone through that horror. Somebody is saying that I honestly don't want to get above blue collar. 30 years dishwasher and now doing overnight freight stocking at grocery store until they got all their rules, able to do everything. I know I have a skill that's always needed. I never have wanted to be rich, mainly because of what I saw of the upper class as I was growing up. Just because you work blue collar doesn't make you dumb or a pushover. I'm proud of the work I've done ever for the years. I always do my best because of the respect I have for the job that I do. So somebody also said that I am both an empath and have a CPTSD as a result of early childhood trauma. I have worked for an insurance company in customer service for 6 years and ended up having a full-blown nervous breakdown. I love people, particularly people in pain. I would want to help. The personal abuse received in the office and the treatment of the insured was abnormal. I was always considered top performer, but I paid with my soul. I understand. Because sometimes you don't just work for the company. It's about you as a person. It's about you with your personality. It's about how you perceive. It's about how you decide to treat people. That's all that matters. Somebody said that when my daughter was dying from cystic fibrosis, she lived a few years after this incident. She couldn't eat. She coughed so much that what calories she did get were used up by a constant coughing. So she weighed about 45 pounds at age 14. The remedy to help her was a feeding button. The insurance company denied everything because, according to them, she was no longer ill. I fought for about a year until she was reinstated. Well, it turns out that they were right. She is no longer ill. She is dead. She did get her gastric button because Texas Crippled Children program stepped up to the plate. That's so sad. That's really sad. That's the corporate greed that we're talking about. And people are coming out to share their story. It's really, really, really a dirty game inside there that's happening. Somebody also said that my husband had 2 surgeries this summer for bone and the tissue removal from sepsis and the abscess. The tissue was so damaged that the bone was still exposed after weeks of having a wound vac. The surgeon did another surgery to remove the exposed part of the bone and did an artificial graft. The wound healed fast, looks really good. Now our insurance company, Blue Cross, just sent us a letter stating they are denying the claim that for the surgery because the surgeon used an artificial skin graft which they deemed experimental. We thought it was pre-approved. I don't know if the hospital will try to fight this or not. We will. There was been a corporate takeover of healthcare system in this country. Why isn't Congress doing anything about this big problem? Somebody also said that. Somebody also said that when my wife had a cancer 20 years old, we were told by a retired agent that their policy was to always deny a claim. Most people give up and go away. Some will resubmit the claim and they will deny those too. Some will give up and go away. A very few will submit at that time. And those who are the ones they will pay because those people will never give up and go away. My wife was one who will never give up. We got 90%, that's 450,000 bucks of our claims paid. But it was struggle for us in our final days, added to our struggle just to survive. Also, we had an insurance, one through United. Each company said it was the other company's responsibility to pay. That's why we only got 90% for bills covered. I felt fortunate to only have to pay 50,000 out of my pocket by the end. Somebody is saying that amazing how the killing of a person can bring out so much dirty, disgusting information about a corporate. In this case, people who have your healthcare in their aids. I worked as an RN for a cardiology group. Clinic have to pay a large staff just to get through the pre-authorization gauntlet. With the insurance corporations adding to costs, the process causes delay in care, and they demand all this paperwork. So this one insurance lady sends a message to one of the cardiologists wanting to know why he is doing this one test and not the one they recommended. He is so exasperated. At this point, he says, "Tell her because I am a cardiologist and she is not." Fast forward, I retired and got an original Medicare with a supplement. I recommend you do the same once you retire. Don't get an Advantage plan or HMO. Once you do, you go back. You cannot go back. A little rule the insurance industry, and Republicans got passed. Original Medicare does not require pre-authorization, but they do look for and go after the fraud. Medicare pays 80 to 100% depending on the category. The supplement you get will pick up the rest. They will not be able to deny you at that point. The more of us are in Medicare, the harder it will be for Republicans to destroy it. Thank me later. People shared how they have experienced, how they have felt so played in this video, and I hope that we all get to learn, we all get to see everything that really happened. As you know, these are presented unique stories, and I'm hoping to see you in my next video. It's a sad story, but until then, peace, love, and harmony. Salute.